Hello everyone, welcome to the series on dental anatomy. In today's video, we will discuss about permanent maxillary second premolar, its chronology, dimensions and morphology. But before moving forward, let's understand some basic points. There are 4 premolars in the maxillary arch, 2 on the right side and 2 on the left side. The maxillary second premolar is the fifth tooth from midline. That is, if you draw a midline and start counting backwards, we will get 1, 2, 3, 4 and fifth tooth as the permanent maxillary second premolar. It is present posterior to maxillary first premolar and anterior to maxillary first molar. That is, if we have to describe the position of permanent maxillary second premolar, it is posterior or distal to first premolar and anterior or mesial to first molar. Now coming to the function of the tooth. Basically, it supplements the maxillary first premolar in function and helps in number 1, grinding or crushing of food, number 2, providing support to the cheeks, and number 3, maintaining vertical dimension of the face. Now moving on to the tooth numbering system. As per the FDI system of notation, these are represented using the digits 1-5 and 2-5, where 1-5 represents upper right second premolar and 2-5 represents upper left second premolar. So in this picture, the second premolar on the right side will be denoted by the digits 1-5 and the second premolar on the left side will be denoted by the digits 2-5. In the universal system of notation, we use the numbers 4 and 13 to represent upper right and upper left second premolar respectively. Lastly, we have the Zsigmondy-Palmer notation system. Zsigmondy-Palmer system of notation. In this, we use the symbol 5-5 or 5-5 to represent upper right and upper left second premolar respectively. Now moving on to the chronology of the tooth. The permanent maxillary second premolar erupts at the age of 10 to 12 years. The first evidence of calcification is seen at 24 to 27 months. The crown formation is completed by 6 to 7 years and the root is completed by 12 to 14 years. Next, we will look into the dimensions of the tooth. The overall length of permanent maxillary second premolar is around 22.5 mm, of which the crown is 8.5 mm long and the root measures around 14 mm. The mesiodistal diameter of crown is 7 mm at the crest of curvature and 5 mm at the cervix. The buccolingual diameter is around 9 mm at the crest of curvature and 8 mm at the cervix. Lastly, the curvature of the cervical line. It is around 1 mm on the mesial side and 0 mm on the distal side. If we compare the maxillary first premolar and maxillary second premolar, the average dimensions are almost identical, but the second premolar shows more variation in size. It is less angular in outline, have more rounded appearance and presents a single root. Now let's understand the surfaces, line angles and point angles. The permanent maxillary second premolar have 5 surfaces. These include the buccal surface, lingual surface, mesial surface, distal surface and the occlusal surface. There are 8 line angles in permanent maxillary second premolar, which includes the mesiobuccal line angle present between the mesial and buccal surface, distobuccal line angle present between the distal and buccal surface, mesiolingual line angle present between the mesial and lingual surface, distolingual line angle present between the distal and lingual surface, bucco-occlusal line angle present between the buccal and occlusal surface, disto-occlusal line angle present between the distal and occlusal surface, lingo-occlusal line angle present between the lingual and occlusal surface, and mesio-occlusal line angle present between the mesial and occlusal surface. Moving on to the point angles, there are 4 point angles in maxillary second premolar. These include mesio-bucco-occlusal point angle, disto-bucco-occlusal point angle, disto-lingo-occlusal point angle, and mesio-lingo-occlusal point angle. Now let's study the tooth morphology in detail. The permanent maxillary second premolar bears close resemblance with permanent maxillary first premolar. So in our discussion, we will have a direct comparison and will highlight the key differences between the two premolars. Starting with the buccal aspect. The crown is trapezoidal in shape with the shorter of uneven sides towards the cervix. Now when we compare with maxillary first premolar, the tooth is thicker at the cervical portion, The buccal ridge is not as prominent as that of first premolar, and the buccal cusp appears less pointed and is not as long as that of maxillary first premolar. So in second premolar, we have greater thickness at the cervical portion. The buccal ridge is not as prominent as that of first premolar, and the buccal cusp is less pointed and not as long as that of first premolar. Now coming to the crown outlines, the mesial outline is slightly convex from the cervix to the point it joins the mesial slope of the buccal cusp, and the crest of curvature is present at the junction of occlusal and middle third. The distal outline is more convex than the mesial outline, and the crest of curvature is in the middle third of the crown, cervical to the mesial contact area. The occlusal outline is formed by the tip of the buccal cusp and its mesial and distal slopes. As discussed previously, the cusp tip is less pointed than that of maxillary first premolar. The mesial slope is almost straight and may present concavity or notching, while the distal slope is more convex or rounded. The important point to note here is that the mesial slope of the buccal cusp is shorter than the distal slope. This is in contrast to maxillary first premolar, where the mesial slope is greater than the distal slope. So this point must be remembered that in all permanent canines and premolars, the mesial slope is smaller than the distal slope, except for maxillary first premolar, where the mesial slope is greater than the distal slope. Lastly, the cervical outline of the crown is slightly convex with the curvature towards the root apex. Now coming to the lingual aspect. The tooth appears similar to the lingual side of maxillary first premolar. Except for the lingual cusp, which is larger than the lingual cusp of maxillary first premolar. This makes the lingual surface appear broader and longer, and less of the buccal cusp is visible from the lingual aspect of second premolar. The crown outlines are similar to that seen from the buccal aspect, that is, the mesial outline is almost straight while the distal outline shows more convexity. The occlusal outline formed by the lingual cusp tip and its mesial and distal slopes, and the cervical outline is curved in the apical direction. Now coming to the mesial aspect of the tooth. The crown is trapezoidal in shape with the shorter of uneven sides towards the cusp tip. Compared to maxillary first premolar, the mesial surface is smooth and convex, and there is no developmental depression as seen in maxillary first premolar, although a shallow developmental groove can be seen on the root surface. Also, there is no developmental groove crossing the mesial marginal ridge. The other point of difference is that the buccal and lingual cusp are nearly similar in length, in contrast to maxillary first premolar, where the lingual cusp is smaller by around 1 mm. Also, the intercuspal distance is greater in second premolar, widening the occlusal surface buccolingually. Now coming to the crown outlines. The buccal outline is convex near the cervix and becomes straight or less convex as it moves towards the buccal cusp tip. And the crest of curvature is located at the junction of cervical and middle third. The lingual outline presents uniform convexity from the cervix to the lingual cusp tip, with the crest of curvature often present near the center of middle third. The occlusal outline is formed by the mesial marginal ridge and is often straight with concavity in apical direction. Lastly, the cervical outline is slightly curved in the occlusal direction. Now coming to the distal aspect. It is similar to the mesial aspect except for the curvature of cervical line, which is often straight. If you remember the previous slide on dimensions of tooth, there we had discussed the curvature of cervical line is around 0 mm on the distal side, while on the mesial side it is 1 mm. Now when we compare to maxillary first premolar, the key difference is the location of root depression. In maxillary second premolar, the root depression on the distal side is greater than the mesial root depression, while in maxillary first premolar, the depression on mesial surface is greater than the distal root depression. This point also has great clinical significance in periodontics, especially during scaling and root planning. A proper knowledge of where these depressions are facilitates appropriate periodontal instruments during scaling and root planning. Now coming to the occlusal aspect. The crown outline is more rounded or oval rather than the hexagonal shape seen in maxillary first premolar. The crown is less angular with less prominent buccal line angles. As can be seen in the picture, the mesiobuccal line angle and distobuccal line angle are less prominent and more rounded. Also, the lingual taper is less since the buccal and lingual cusp are of equal size. Now let's look at the important landmarks seen on the occlusal surface. First we have the buccal cusp and the lingual cusp. As discussed before, the cusps are of similar size and have less pointed cusp tip in contrast to maxillary first premolar, which presents a smaller lingual cusp. Next we have the mesiobuccal cusp ridge and distobuccal cusp ridge in the buccal cusp, that is mesiobuccal cusp ridge and distobuccal cusp ridge extending from the buccal cusp tip to the mesiobuccal line angle and distobuccal line angle respectively. Similarly, there is mesiolingual cusp ridge, mesiolingual cusp ridge and distolingual cusp ridge extending from the lingual cusp tip to the mesiolingual line angle and distolingual line angle respectively. The buccal triangular ridge and lingual triangular ridge seen in maxillary first premolar are not prominent or well developed in maxillary second premolar. However, the mesial marginal ridge and distal marginal ridge are strong and well developed, but there is no mesial marginal developmental groove crossing the mesial marginal ridge. Next, coming to the depressions, the permanent maxillary second premolar have a central developmental groove located at the center of the occlusal surface. The central developmental groove is shorter and more irregular when compared to that seen in maxillary first premolar. The central groove presents multiple supplemental grooves extending into the shallow depressions in the enamel. These supplemental grooves gives the occlusal surface a wrinkled appearance. The depression distal to mesial marginal ridge is known as mesial triangular fossa, and the depression mesial to distal marginal ridge is known as the distal triangular fossa. So that was all about permanent maxillary second premolar. In the next video, we will discuss about permanent mandibular first premolar. Till then, if you found the video helpful and informative, then do like the video, share it with your friends and subscribe the channel for more such content.